Welcome, David Wiss here, dietitian, nutrition and recovery. Today we're going to talk about the opioid crises. As you probably know, we are in an epidemic and there is a need to find solutions. I recently published a paper called a Biopsychosocial Overview of the opioid crises considering nutrition and gastrointestinal health. Now, one of the major premises is that opioids affect the gut. How can we use nutrition to improve the gut and potentially improve recovery outcomes? The major feature of the article is this diagram. I call it the Biopsychosocial Perspective. It looks at substance consumption as a whole, so not just opioids, but anything that's dopaminergic, alcohol, caffeine, nicotine, food, etc. So it looks at the social factors that drive substance consumption, all the biological factors, and all the mediating mechanisms. So it's a little complicated. I'm going to do my best to break it down today in the context of the opioid epidemic. We know that when there's environmental exposure, unlimited or highly accessible opioid prescriptions and illicit opioids, people are going to use them, period, right? So access is an obvious point of intervention. There's been big push towards reducing prescriptions of the various painkillers out there. The most well-known is OxyContin, which skyrocketed in the late 90s and then has recently been under a lot of lawsuits. So there's funding now to reduce prescription drug use. There's a lot of policy changes underway to meet the needs of the crises that we have gotten in. But of course, reducing prescription opioids doesn't necessarily lead to reduced heroin. We have illicit forms of opioids, including fentanyl and carfentanil, entering and leading to a lot of misuse, overdose, and death. The big question is, where does all the pain come from? What's the major driver of people's need for painkillers, and why does it feel so good? And, one of the areas I'm really interested in is how early life adversity, how trauma, whether it be complex or PTSD, stress and toxic stress, set up the need for rewarding experiences. More interestingly is the question of how do different people respond differently to adversity. One person might build resiliency and be protective and have a lower risk of substance use disorder, whereas the next person might have changes in the way their brain processes rewards and have a heightened risk of specific disorders. This diagram basically summarizes the link between trauma, PTSD, leading to anhedonia, substance use disorder. And you could see this diagram is cyclical, meaning there's feedback loops which create and recreate. And this is common with addiction models. You could see this is one of the most popular current models of the brain disease of addiction that involves a cyclical nature. When someone uses and then there's an effect produced by not using, we call it withdrawal. The mind comes in, there's preoccupation, and this cycle continues and eventually leads to neuroadaptations. So chronic exposure to a substance that is addicting will change the brain, and that's what we know. We also know that stress and adversity can change the brain. So we're looking at what are some of the potential interventions that we can create that will break this devastating cycle. Now, I've become interested in the microbiome. We do have evidence that opioid and other morphines and different medications affect the bacteria that live inside of both humans as well as animal models. So the question becomes, if microbiome is a mediator between stress and adversity and altered pain sensitivity, etc., is there anything we can do to step in? Can nutrition alter someone's microbiome, change the epigenetic expression, and essentially alter the brain? And this is something that isn't going to happen in a day or a week or even a month, or probably not even a year. It's something that can happen over the span of one's life. So I've included the life course perspective here, which really looks at how certain things accumulate over time. It also includes how traits and risk factors can be inherited at the intergenerational level. So the life course perspective kind of recycles all of the different risk and protective factors that I've identified in the model. Of course, socioeconomic status is very important. It links the environment to increased risk for adversity and trauma, and should be involved in any model that involves human beings. As we know, it's a major predictor of health outcomes. So what does it all mean, right? For opioid use disorder, do we need different treatments? How much do we need to consider trauma? How much do we need to look at the neuroscience? And if we are looking at the brain, is it always pharmaceutical, or can we consider nutritional and nutraceutical approaches? So there's a lot of different avenues that we can use to intervene. Compared to medication, nutrition is slow, but from the clinical work that I've been doing, I can say nutrition is effective. And people that use gut-based nutrition interventions in early opioid recovery have increased likelihood of getting improvements in mental health, which is going to lead to improved chances of recovery, not just staying alive, but having recovery and being able to face life successfully. I believe that stigma is still recovery's greatest enemy. If you have questions about any of this, or want to talk recovery, opioid, nutrition, please feel free to reach out. The paper mentioned in the presentation today is open access, so you can download it. Would love to get some comments from you.